Hi everybody, and welcome to USMLE Help. I am currently a medical student getting ready to finish up. I'm here in Chicago doing my clinical rotations, trying to finish up some electives, and I recently finished USMLE Step 2 CK, which I know is a large hurdle for many people, some needing the scores, whether you're for in medical grad, maybe you need these scores to bring up your low USMLE Step 1 scores, or maybe you just want to keep your Step 2 scores similar to your Step 1, whatever it may be. I decided to start these videos because I couldn't really find anything on the internet that was, number one, free, because as a medical student money can be pretty tight, quick, and well structured. And more important out of all of those is probably the structure. And what I want to do is start a set of videos, one after the other, that will be no longer than 10 minutes ever. And essentially what I want to do is have a high yield, highly structured, interactive video series. And what I mean by interactive is that I would like to ask questions, as typically is done on the floor in your clinical rotations, and then have some time. I'll set like 10-20 seconds for a pause in my videos, and that'll give you time to answer. And then I will give you the answer after that. Now, if you can't answer within those 10-20 seconds, the idea is for you to pause these videos and use that time to brush up on what you may need. Because what I'd like to do is structure the videos after what you see in your clinical rotations. And why I think that's important is because, as many medical students find out, is that they study hours after hour after hour, whatever it may be, and once you're asked these questions on the floor, you're put on spot, everybody's looking at you, the answers don't come up. Now, why is that? Is it because you don't know the information? I don't think so. Usually what you find is that 5-10 minutes later, the answer comes to you. Well, it's because the information isn't structured in your head to where it can come out quickly. Your brain needs structure in order to categorize information so that it can come out more fluently, quicker. And that's what medical students aren't doing when they're studying. They're trying to pack in a lot of information, it's packed in a random order, and it comes out random. Well, you aren't asked random questions on the floor. These questions are designed for a purpose, and they're typically high yield, and they typically demand that you have categorized them well so that you can answer the questions for specific situations that you may see with your patients while you're rounding. And that's the idea of these videos. Now, right now I want to give you an example of what I mean, and this is just an example, and I chose the thalassemias. Now, the way this will work is what I will do is I'll present a topic, and the example here is going to be thalassemias. And what I'm going to start with is, just like you'll see on the floor, you may have an attending say, medical student so-and-so, what is a thalassemia? And just like that, I'm going to give you a few seconds. Now, the first thing you should do when you're studying these things is to get the definition right first. What you'll find is a lot of people go straight into the details of the disease, but they don't really know how to define it. And that's a problem. These videos are going to be structured so that the first thing I'm going to ask you to do is to define what the disease is. Then I'm going to ask you to tell me how the patient will present to you. Then I'm going to ask you how you will diagnose this disease, so you know that's exactly what you're dealing with. And then the last thing, I'm going to ask you, what is the treatment you would do? And this is typically how the flow of questions will go on the floor with your attendings. So let's start with the example. So the first thing I'll typically do is I'm going to ask you, today we're going to talk about thalassemias. So I want you to, can you define thalassemia for me? Okay, now there I gave you about 5 seconds to answer, so you should be able to define it right now. Now at this point, if you can't define what a thalassemia is, that's okay. The definition of thalassemia is a decrease or absent production of globin chains. Done. That's the first part of the disease you need to know. Now the second part, I'm going to go into the structure, and this is categorizing the diseases that I was talking about. The first is going to be what types of thalassemias are there? Now usually I'd give you a little bit more time, but this is just an example video. And how I want you to structure these is go, well, there are betas and there are alpha thalassemias. And now, of course, my next question to you is going to be, what types of betas and what types of alphas? What types of beta thalassemias are there? Well, you should have answered there's beta thalassemia major and beta thalassemia minor. Now, what differentiates the two? Beta thalassemia major has no beta globin chains. This is the most severe of the betas, and you're going to see a severe microcytic anemia in the first year of life. These patients are typically going to need chronic transfusions, excuse me. The beta thalassemia minor, they have one beta globin variant that's okay. These patients are typically asymptomatic, but they will have the microcytic anemia you'll typically see. Now, the next question will be, what types of alpha thalassemias do you have? Your answer should be, and this goes, I'm going to categorize this from worst to least worst. That sounds silly, but it's an easy way to remember it. So, the most devastating of the alphas is hydrops fetalis, of course. These fetuses die in utero because they have no alpha chains. The next is hemoglobin H disease. These patients have one alpha globin chain. Next is alpha thalassemia trait, where these patients have two alphas, and the silent carrier has 3 of the 4 that's normal. So my next question, as these videos will be structured, is going to be how do you diagnose them? Well, we just did that, and you're going to go through electrophoresis evaluation for all of these, okay? And we sort of went through that when I described what the difference between betas and alphas were, okay? And the next question is going to be, what are the treatments? So this is typically the last question you're going to ask on the floor, and probably one of the more important ones. And most patients do not require treatment when you're dealing with thalassemias, but those with beta thalassemia major and hemoglobin H disease are commonly transfusion dependent, meaning they will need transfusions to live, and should be given. You also need to give iron chelators to prevent overload. Now, they usually won't have iron chelators in your questions. They're going to show you desferrioxamine, usually. Okay, now this was an example. Now, in the videos to come, I'm going to give you time to answer the questions. I went really fast this time. I just want to give you some examples of how these are going to go. And like I said, these videos are to be used over and over and over again to where you have them memorized. And this is a question-answer format that's going to help you in the clinical semester. So you can go home and have the same sort of question-answer scenario like you do on the floor. I hope you enjoy the videos and stay tuned. I'll have many, many more to come.